did our project on patent ductus arteriosus. My name is Lauren Faria.
Willie Shield.
Connor Reynolds.
Alright, so as many of you want to know, what is patent ductus arteriosus? So patent ductus arteriosus is a congenital heart defect. PDA is a persistent opening between the two major blood vessels leading from the heart. The ductus arteriosus is a normal part of a baby's circulatory system before birth that usually closes shortly after birth. But if it remains open, it's called a patent ductus arteriosus. So some symptoms you can get, obviously, as when you are a baby, vary with the size and whether the baby is full term or premature. A small PDA can give no signs or symptoms, while a large PDA can cause signs of heart failure soon after birth. A doctor might first suspect a heart defect after hearing a heart murmur while listening to the heart through a stethoscope. A large PDA found during infancy or childhood might cause poor eating, which leads to poor growth, sweating with crying or eating, persistent fast breathing or breathlessness, easy tiring, and also rapid heart rate. All right. So some causes for patent ductus arteriosus. The congenital heart defects start from issues early in the heart's development, but there's often no clear cause. Before birth, the ductus arteriosus between two major blood vessels leading from the heart is necessary for a baby's blood circulation. The ductus arteriosus diverts blood from a baby's lungs while they develop, and the baby receives oxygen from the mother's circulation. After birth, the ductus arteriosus normally closes within 2 or 3 days. In babies born premature, the connection takes longer to close. If the connection stays open, it's referred to as a patent ductus arteriosus. The abnormal opening causes too much blood to circulate to the baby's lungs and heart. The blood pressure in the baby's lungs can increase if untreated, which will weaken the heart, which is not very good. All right, so now, class, we know the background, the general knowledge of patent ductus arteriosus. Now, let's hear about the risk factors. So, premature birth. Patent ductus arteriosus occurs more commonly in babies who are born too early. Also, family history. A family history of heart problems and other genetic conditions increase the risk of having PDA. Also, rubella infection. If you contract German measles during pregnancy, your baby's risk of heart defects increases gradually. The rubella virus goes into the placenta and spreads to the baby's circulatory system, damaging blood vessels and organs, such as the heart. Also, being born at a high altitude, babies born above 10,000 feet have a higher risk of patent ductus arteriosus. And last but not least, being female, PDA is twice as common in females.
Some complications with large PDAs are heart infection or endocarditis, heart failure, or high blood pressure in the lungs, also called pulmonary hypertension. What can be done about the PDA? So there's 2 options for surgical procedures. One of them can be closure by device, which is the first picture on the left, and it's a little metal clip or on the right, closure by tying off, they use like a little rubber tie to tie off the valve that's not closed.
All right, surgery for patent ductus arteriosus. Most children can have the PDA closed by surgery. Previous slide shows examples of how catheterization is used to close the ductus. An incision is made in the left side of the chest between the ribs. The ductus is closed by tying it with thread-like material or by permanently placing a small metal clip around the ductus to squeeze it closed. If there's no other heart defect, this restores the child's circulation to normal. In premature newborn babies, medicine can help it close, but after the first few weeks of being born, medicine won't work as well to close the ductus, and that is when the surgery might be required.
For prevention of patent ductus arteriosus, there is no way to specifically prevent it. However, a woman should do her best to have a healthy pregnancy. These things include doing things like avoiding infections, keeping a healthy diet, exercising regularly, and managing diabetes to keep it under control. For my case of patent ductus arteriosus, it started off at one of my first doctor's appointments. A nurse practitioner was examining me, and she excused herself and left the room. And when she came back in the room with the doctor, they told my mom that they heard a heart murmur and referred my parents to a pediatric cardiologist. When we saw the cardiologist, the options were to either wait and see if I grew out of it, or there was a new procedure that hadn't been done many times before. And then there was the PDA surgery that they had been doing for years. My parents opted for that. It had been proven to work, and my parents said they just wanted it fixed. Although the doctors were surprised I was such a chunky baby, as most babies with PDA do not gain much weight. I also have a right aortic arc, where most people have a left aortic arc. Right-sided aortic arc is a rare anatomical variant where the aortic arc is on the right side rather than on the left. My surgery was done on December 13th, 2000, and it took about 2 hours. For family genetics, my family has a long history of heart problems. My paternal grandmother had heart issues, and my maternal grandfather has a heart murmur. One of my mom's cousin's baby was diagnosed with a bicuspid aortic valve stenosis when she was 6 months pregnant. When he was born at 6 months old, he had a K-arctation of aorta done. He is 13 years old now. Another one of my mom's cousins was also 6 months pregnant when she found out about her daughter's heart condition. Her child had her first open heart surgery called the Glenn procedure at 1.5 years old. She had many heart catheterizations. Now at 11 years old, she will be having her second open heart surgery this upcoming August to input the pulmonary valve she is missing. Another one of my mom's cousins had PDA also, but they decided to wait and see if he grew out of it, and he did. Just some fun facts that I found about patent ductus arteriosus. It's possible for dogs to have patent ductus arteriosus, and it's caused by a genetic predisposition or a birth defect. A veterinarian will do a physical exam on a dog, running tests like chemical blood profile, a complete blood count, urine analysis, and an electrolyte panel. The level of oxygen in the dog's blood may also be tested. Symptoms in dogs are increased breathing rate, exercise intolerance, coughing, weak hind legs, blood clots, bluish gums, irregular heartbeats, and stunted growth. Without correction of the PDA at a young age, the condition can cause heart failure and lead to death for dogs. PDA is the most common congenital cardiac malformation in dogs, but is very uncommon in cats. Dogs can undergo surgery to fix the PDA.
All right, finish things up. This is our works cited, and we thought the most beneficial website that we used was the American Heart Association. Yeah. This concludes our presentation.